Beyond immune therapy, it's very important to recognize the continued benefit of targeting mutational burden, and in particular some of the promise around venetoclax, which has really been focused on the 11-14 translocations that are seen in a subset of patients with myeloma. Beyond that, I think we have to see, there's been a recent safety concern with venetoclax, but I'm confident that especially in the 11-14 population, the clinical benefit is so substantial. I'm very hopeful that the drug will continue to have momentum and make progress in that space. In the other setting of mutational burden, there are a variety of novel small molecules under evaluation, and perhaps one of the most exciting is the selective inhibition of nuclear export protein, the XPO1 targeting small molecule selinexor. This drug, I think, is fascinating. It's an oral agent that's administered once or twice a week. Once a week in combination appears to be very active, particularly with other drugs such as bortezomib. And this particular drug works by blocking the export of proteins that would otherwise normally suppress the malignant genome, and in that regard suppress oncogenic thrust, and in that context allow a stabilization of the malignant genome in a way that actually is pro-apoptotic and triggers obviously control of the malignant cell. So this whole construct around this agent I think is particularly fascinating because it may be very important, particularly in high-risk disease. It seems to be very effective in combination, and early trials have been promising, particularly in the single-arm setting, randomized data coming. I'm very hopeful that selinexor will make its way into FDA approval later this year.